Hepatitis C. Hepatitis C is a viral contamination that causes liver inflammation, here and there prompting genuine liver harm. The hepatitis C infection, HCV, spreads through sullied blood. As of not long ago, hepatitis C treatment required week-after-week infusions and oral drugs that numerous HCV-tainted individuals couldn't take in light of other medical conditions or unsuitable results. That is evolving. Today, ongoing HCV is normally reparable with oral meds required each day for 2.5 years. In any case, about portion of individuals with HCV don't realize they're tainted, basically in light of the fact that they have no side effects, which can require a long time to show up. Hence, the U.S. Preventive Services Task Force prescribes that all grown-ups ages 18 to 79 years be evaluated for hepatitis C, even those without side effects or known liver illness. The biggest gathering in danger incorporates everybody brought into the world somewhere in the range of 1945 and 1965, a populace multiple times bound to be contaminated than those brought into the world in different years. Indications. Long-haul disease with the hepatitis C infection is known as ongoing hepatitis C. Ongoing hepatitis C is generally a quiet contamination for a long time, until the infection harms the liver enough to cause the signs and manifestations of liver illness. Signs and indications include bleeding, easily bruising, easily fatigue, poor appetite, yellow staining of the skin and eyes, jaundice, arc-colored urine, itchy skin, fluid buildup in your abdomen, ascites, swelling in your legs, weight reduction, disarray, sleepiness and slurred discourse, hepatic encephalopathy, spider-like veins on your skin, arachnid angiomas. Each ongoing hepatitis C disease begins with an intense stage. Intense hepatitis C typically goes undiscovered in light of the fact that it infrequently causes indications. At the point when signs and side effects are available, they may incorporate jaundice, alongside weariness, sickness, fever and muscle throbs. Intense indications seem 1 to 1/4 of a year after openness to the infection and most recent 14 days to 1/4 of a year. Intense hepatitis C disease doesn't generally get ongoing. A few group clear HCV from their bodies after the intense stage, a result known as unconstrained viral freedom. In investigations of individuals determined to have intense HCV, cases of unconstrained viral freedom have fluctuated from 15% to 25%. Intense hepatitis C additionally reacts well to antiviral treatment. Causes. Hepatitis C contamination is brought about by the hepatitis C infection, HCV. The disease spreads when blood sullied with the infection enters the circulatory system of an uninfected individual. All around the world, HCV exists in a few particular structures, known as genotypes. 7 unmistakable HCV genotypes and more than 67 subtypes have been distinguished. The most widely recognized HCV genotype in the United States is type 1. Albeit ongoing hepatitis C follows a comparative course paying little heed to the genotype of the tainting infection, treatment suggestions change contingent upon viral genotype. Risk factors. Your danger of hepatitis C contamination is expanded in the event that you are a medical care laborer who has been presented to tainted blood, which may occur if a contaminated needle punctures your skin. Have at any point infused or breathed in unlawful medications. Have HIV. Gotten a puncturing or tattoo in a messy climate utilizing unsterile gear. Gotten a blood bonding or organ relocate before 1992. Gotten coagulating factor concentrates before 1987. Gotten hemodialysis medicines for an extensive stretch of time. Were brought into the world to a lady with a hepatitis C disease. Were ever in jail. Were brought into the world somewhere in the range of 1945 and 1965, the age bunch with the most noteworthy occurrence of hepatitis C contamination. Difficulties. Hepatitis C disease that proceeds over numerous years can cause huge confusions, for example, scarring of the liver, cirrhosis. Following quite a while of hepatitis C contamination, cirrhosis may happen. Scarring in your liver makes it hard for your liver to work. Liver disease. Few individuals with hepatitis C disease may foster liver malignancy. Liver disappointment. Progressed cirrhosis may make your liver quit working. Avoidance. Shield yourself from hepatitis C contamination by playing it safe. Quit utilizing illegal medications, especially in the event that you infuse them. In the event that you utilize illegal medications, look for help. Be wary about body penetrating and inking. On the off chance that you decide to go through penetrating or inking, search for a legitimate shop. Pose inquiries previously about how the gear is cleaned. Ensure the representatives utilize sterile needles. In the event that workers will not answer your inquiries, search for another shop. Practice more secure sex. Try not to participate in unprotected sex with different accomplices or with any accomplice whose well-being status is dubious. Sexual transmission between monogamous couples may happen, yet the danger is low.